Welcome, everyone. It's my pleasure to welcome you all here today. My name is Rosie Frasso. I'm the Director of Public Health at Thomas Jefferson University, and I have the honor of moderating this panel this morning. We have a talented group of panelists in front of you here. They have dedicated many years towards addressing this important issue. Human trafficking leaves so many victims with lifelong scars and challenges. The purpose of this session is to raise awareness of human trafficking provided by these important local, national, and global statistics about trafficking that will help us understand the gravity, the incidence, and prevalence of this issue. We want folks to be able to recognize the signs of potential victims of human trafficking and be prepared to respond in caring and meaningful ways. By the end of the session, we hope that you will be able to make a difference in the lives of others. Our first and lead speaker today is Jean-Ann Susu Coppola. She's a doctor of nurse practice and a clinical assistant professor at Rutgers University School of Nursing. She has 18 years experience as a certified nurse midwife and more than 14 years teaching as a nurse educator. She's earned the Distinguished Teaching Alumni Award at Rutgers School of Nursing in Camden, and her passion for teaching undergraduate and graduate students is unlimited. She's also a digital faculty fellow at Rutgers and incorporates various interactive modalities into her teaching. I think we're going to see some of those today. She has a strong interest in peer mentoring and has developed a faculty mentoring program at Rutgers, which includes addressing important public health issues like human trafficking. Dr. Coppola is well-researched and published in this space. And Dr. Coppola is a faculty fellow at the Walter Rand Institute for Research. All right, our next panelist is Ingrid Johnson, also a nurse and a mother of a survivor of human trafficking. She's the manager of patient access at Overlook Medical Center and a member of the Atlantic Health System. Ingrid represents Atlantic Health Systems on the New Jersey Coalition Against Human Trafficking and Human Trafficking Advisory Council, led by the American Hospital Association. She serves on national and local committees to address the issue of human trafficking and its impact on vulnerable populations. She earned her bachelor's and nursing degrees at Seton Hall University and is a member of the Sigma Theta, I'm terrible with the Latin things. She's a member of Sigma Theta Sau, is that right? Honor Society and the Gamma Nu chapter and Gold Key National Honor Society. In addition, she's a member of an organization of nurse leaders in New Jersey as well as across the US. So it's going to be exciting to hear from you and very generous of you to share some lived experience with someone you love around this issue. Diana Stars has led the Injury Prevention Program and Safe Kids for Middlesex County Coalition at the Robert Wood Johnson Hospital Level 1 Trauma Center in New Jersey since October of 2003, so clearly brings a lot of experience to the table. Diana's a team member and has worked with many community partners to educate the public about the issues of accidental injury and other related prevention strategies. She works her role really lets her leverage and do teaching and work that makes a difference to keep people safe and well. So I'm going to open this up to Jean-Ann to begin the discussion with a presentation. We'll have questions that we'll field and I will share with the presenters and panelists. We look forward to an engaging session and I know that I'm going to learn a lot and I'm excited to be here.
Thank you, Rosie. I'm actually going to yield the floor to my colleague Ingrid, who's going to start. And I'm going to share my screen and advance the slides on her behalf.
Great, thank you. Thank you for having all of us with you today. I am so appreciative as the mother of a survivor of human trafficking to have this opportunity. And so let's just start by acknowledging that human trafficking awareness, and actions, should be towards this public health crisis. And I don't think we say that often enough, that this is a public health crisis. So next. So we'll get into the presentation. So what is human trafficking? I'm sure lots of you always ask that question and you probably don't feel you get a clear enough answer, but we hope at the conclusion of our presentation today, we would help you with that. So it's involving sex trafficking, money, labor trafficking, and minors, as well as adults. And it can involve force, fraud, or coercion. That's the legal mumbo jumbo. Worth repeating is the force, fraud, or coercion. Now, if you're a minor, you don't have to demonstrate those operatives in the court of law, but they're important to remember: force, fraud, or coercion. So next. So what is not human trafficking, right? We get this confused. It's not the same as smuggling, and it doesn't have to have any physical movement. So you must say and scratch your head and wonder, like, wow, yes, someone could be trafficked right under your nose. You don't have to see all this movement and all the things you see in the media that try to help you define it. So, again, we're trying to get to some clarity about what human trafficking is and what it is not. So next. So where is it? You have 25 million people in the world who are said to have been trafficked. 75% of the victims are women and children. And that leaves the men and the boys out there as well, because we're listing women and children. And then 81% of those cases involve forced labor. Well, I know about that firsthand because my daughter was forced. 1/5 of the cases involve sex trafficking. And this is $150 billion industry annually. So I'll take just a moment to tell you a little bit about my daughter. My daughter was 13 years old in 2005. We came from what we thought was a decent home. We didn't have the social elements that one would expect me to speak about. They were absent. My daughter was an honor roll student. She was in a gifted and talented program in our local New Jersey public school-based system, hanging out with friends and just being a kid, which all of us were kids at some point in our life, right? You just want to build your friend base and deal with your peers. And my daughter went missing, and she went missing for 11 months. And so from 2005, it brought me to a place in my life where I would dedicate my life to eradicating human trafficking. At the time, I didn't know what it was. I had no clue at all until someone told me about it. And this came after rescuing my daughter. So I just want to share with you why these statistics mean so much to me. My daughter was not counted as a tick mark on the slide that we're reading from. She was listed as a missing person and thought to be a runaway, which eventually, when recovered, we found out about human trafficking. So our next slide. So here we have over 11,000 cases reported in the US to our national hotline, which you'll learn more about, in 2019 alone. Again, reported. There are other cases that were not reported. And here, 30% of those cases involved forced labor. 70% of the cases, sexual exploitation, and 80% of those sex trafficking survivors are US citizens. Now that must blow your socks away, right? Because you don't even think it's happening in the United States per se. And if it is, not really in my backyard. And to think our own US citizens having that level of involvement, we really still try to believe that this is about just foreign folks being dragged across the US borders and they're at hair salons or nannies. It's not just that. It can include us, the us being the people from our own lineage that are here in the United States as citizens. So next slide. So here we are in the tri-state area talking to folks from all over, but here I am near the 95 corridor where we have an airport and roads and trains and buses. We're densely populated, there's people everywhere, and we're by major cities in this part of the country. I'm a Philly girl myself, so I understand that neck of the woods. We're close enough to New York. I'm 15 minutes from there, about 4 hours from DC, just to put it into perspective for you. And again, we're sharing information that's close to us, that we touch. And I'm sure you have your own stories about what's close to you, and particularly internationally, as well as in the United States. And tourist destinations, they bring our transient population. So, you know, we have easy access for people to move around and be right under our noses and be experiencing human trafficking. Next. So who is human trafficking? As you see, it can affect anyone. So let's just get it out of our minds today that human trafficking looks like this or looks like that, and it couldn't be the person next door. It couldn't possibly be the person at the bus stop. No, no, no. Let's get that out of our mind. It can affect anyone, and everyone can help to prevent it. Yes, I'm talking to you. Everyone, including you, can help to prevent it. Next. So it really does happen here. I think I'm supposed to turn it over to you. So I'm going to stop here and yield it over to Jean Ann.
Thank you, Ingrid. And I'm going to actually echo everything that you've said. Thank you very much for sharing your personal story. So it really does happen here. But when we say here, we're talking about in our local area, the tri-state area. And just to kind of give you an idea, we are, you know, depending on where we are very close to Philadelphia, and we are also very close to New York City, probably about 2 hours, depending on where Ingrid, Diana, and I are currently. But when I say it really does happen here, I'm talking about more smaller urban counties, more smaller urban areas that are near the larger cities. In January of 2020, a child service worker from New Jersey was arrested for trafficking and promoting prostitution. In June of 2019, a man was convicted of sex trafficking after luring a 14-year-old New Jersey girl through social media. So it can happen anywhere, but it doesn't necessarily have to happen in person. It can actually happen online. In 2018 of November, tips about activity at a suburban home led cops to human trafficking connected to a Chinese restaurant in Mercer County. And Mercer County is, I want to say, about 20 to 30 minutes away from Philadelphia if you drove. And then in 2018 of April, a couple was arrested and accused of forcing an underage girl into prostitution at hotels through Bergen, Essex, and Middlesex counties. And those three counties, if you're not familiar, are near the New York City area. And trafficking doesn't exclusively happen in major urban areas, like I said before. And so these are some of the examples of where they can happen. Sorry. Traffickers then seek their victims everywhere. So what do they look for? They look for false love, boyfriending, where they begin to friend they use these tactics in order to friend their victims, and we call them the perpetrators. They offer job opportunities. A lot of young girls are looking for maybe modeling experience. And so the predators seek out these young, vulnerable girls and lure them into thinking that they're going to enter them into a modeling agency. And then that's where they start to pursue them even more. Coercive tactics used by traffickers make it very difficult for the victims to leave. They give gifts. In turn, from those gifts, they expect a now you owe me sequence. It becomes a very vicious cycle. And victims are then convinced that it's their fault that they're stuck in this situation. Victims are shamed and they're told that no one else will now love them, that they're stuck in the situation. Predators may use food deprivation, and that food deprivation then becomes powerlessness. The victim wants some type of sustenance, and in order for her or him to get that sustenance, they have to cave in, they have to give in to their predator, and they feel powerless in that situation. Sometimes another tactic that predators use are that they force drug taking, and that helps to maintain enslavement, excuse me, and numbness. Victims then feel they have nowhere to go. They become exhausted and degraded, and their wills are broken. Trauma bonds develop between the traffickers and the victims. Anyone really can detect the signs of human trafficking. And this slide is really a small snapshot of who can be a part of the helping. If they present to an urgent center, if they present to an emergency room, if they present anywhere, anyone can really learn to identify the red flags of human trafficking, from law enforcement through public health, through social workers, through EMS, to nursing, to anybody, to people who work in the restaurant field. And so again, this is just a snapshot of who can help. And really everyone is in it together, and it's important to look for those red flags. And so I'm going to talk a little bit about what you should do if you feel that you've encountered somebody who is a victim. And we use the acronym HEAR, HEAR. Healthcare professionals, first responders, or really anybody can identify victims based on the presentation. And the presentation is really looking for red flags. If, say, for example, you're in law enforcement, or if you're in EMS, or if you're another emergency care professional, you start to look for very interesting signs. If you are at a person's home, you might see locks that are on some or many of the windows or doors in the facility. If you encounter a victim, they may exhibit signs of physical or sexual abuse. They may seem timid. They may lack eye contact. They may demonstrate signs of intense fear or depression. They may feel like they don't have control. They may not have their personal belongings or their personal papers or their personal identification, or maybe some of their identification may seem fraudulent. Another big red flag is the victims are usually not left alone. There may be someone attempting to speak for them or on their behalf. Whether you're at their home or whether you're in a healthcare facility, they might not be speaking for themselves. Somebody else may be speaking on their behalf, and they may seem dependent on the other person. Their communication may seem scripted, may seem vague. Their story might seem inconsistent. And so you look for those red flags. Sometimes the victims might not speak English. Maybe they're coming from another country and they're here in the States, or they're, from the States in another country. They may be from anywhere. And sometimes the victims might not be very trustful of law or the law enforcement. And so they don't want to provide any information for fear of repercussion. Specific questions that you should ask may include: how did you get here? Where do you live? Where do you eat? Where do you sleep? What type of labor or services do you do? Just very basic questions that might open the door to some interesting answers. What are your hours of work? Have you been paid? When was the last time you were paid? How much are you paid? Who are you afraid of? What are you afraid of? And is someone keeping your legal documents or your legal travel documents if they're from another country? Sorry. So this is just a nice acronym to look for, recognizing the red flags of exploitation and abuse. They may be reluctant to speak. They may be exhausted. They may be dominated or controlled. Fearful, work long hours, alienated or seem alienated from friends or family. Or they may have gifts from older partners or other partners, or a number of gifts that just seem inappropriate for them. And they may also show some signs of physical, mental, emotional abuse. I'm going to now turn the floor to Diana, who's going to speak about what you can do if you've encountered or suspect you have encountered a victim of human trafficking.
You're on mute, Diana.
had myself muted so that I wouldn't hear all the dogs barking in the background.
That's okay, it happens.
Sorry about that. So first of all, I do want to tell you that we are all part of the New Jersey Coalition Against Human Trafficking. And yes, we have day jobs. And yes, we talk about human trafficking to everybody who will listen to us. But I think too, to understand the coalition just a little bit, because we would encourage you to seek out similar organizations in your state or your country. They exist everywhere. And typically, at least in the United States, most of the states have, at the state level, have either a commission on human trafficking or a human trafficking task force. And then coalitions like ours are completely volunteer run. But we are a very strong coalition. And what we do is we really bring together experts, excuse me, of course. Sorry, experts in the field who help us to learn more. We do have a survivor consultant on our coalition who helps us to make sure that we are approaching everything we do through that survivor lens, making sure that we are doing things in a trauma-informed way and a patient or client-centered way. We want to make sure that we create that bond, that trust with whoever that person is in front of us so that we can help them. And that's really in, we're all in the healthcare arena. So we all, are focused on those patients, but it doesn't matter whether you are a healthcare worker, whether you are in the public health arena, whether you're in law enforcement, whatever your field is, you need to look at that encounter in that role, but also just as a member of your community. I say this all the time. Yes, I am an injury prevention coordinator, so that's what I do. But I also belong to different groups in my community. You might belong to a faith-based organization. You might belong to the Rotary or any of those kinds of organizations where you can help to spread the word. And I think that's really what it's about, is to bring people together, connect them with each other, and educate them. Because the only way that we're going to eradicate human trafficking is by raising awareness so that we all know how to recognize it. We understand what it is. We believe and understand that it is happening in our backyard. And I think probably that's one of the biggest myths that we have to overcome, because I'm sure that Ingrid and Jean-Ann would back me up on this. It doesn't really matter who I'm talking to or when I'm talking to them, but the question always comes up from the audience. Well, is it really happening here? I didn't know that. And so it's really important to do a little bit of research on your own and educate yourself so that you know what's going on in your community, and you can locate those organizations that are helping and perhaps join them. Also, legislation is really important. Our coalition does have a legislative committee, and we do work very closely with our legislators to bring action, right? We want to make sure that we are addressing the needs of our survivors. And we do that by passing laws that look at demand and supply, and how do we bring, discipline, what does that look like for perpetrators? So really, really important on all of these aspects. And whenever there is success in bringing a criminal charge and having it really work, it's because law enforcement, the community, advocates, and legislature are working together. That's the only way that works. It's very often that our law enforcement will say, well, we couldn't go after this business for human trafficking because we didn't have the support that we needed for that criminal charge to stick. So instead, we'll go after them for money laundering or drug laundering or something like that. So just know that it's really important for all of these facets of the community to work together to make this work. And I would almost guarantee you that there is an organization in your community that you can look to for this support. Next slide, please. So here's what you can do about it, because I know in the beginning, Ingrid said, all right, so this can happen to anyone, but it's up to all of us to be able to do something about it. And again, that's that collaboration and working together. You're here today, so you obviously were interested in educating yourself. And now we ask you to take this information that you've learned today and do a little bit more research. We'll give you some some resources in a minute where you can go and check out, what's out there, what's happening in your area, and who's out there doing something about it, really so that you can become part of this force, right? That's what really we want to do, is get everybody on board, because that's the only way that we will be able to eradicate human trafficking. We want you to choose fair trade certified products. So that has a direct link to labor trafficking. There are many, many products that are made not only in the United States, but across the world, that are made by people who are not getting paid a fair wage and who are working under unfair working conditions. On the flip side, there are products that are being made that are called fair trade, and those we know have been certified to be made by people who are getting a fair wage and who are working under fair conditions. We have instances right here in New Jersey. We have a very large agricultural industry, right? We're called the Garden State, and we are, but there are many people that work in our agricultural industry who are not paid a fair wage and are not working under fair conditions. And we would call that labor trafficking. You might not think of it that way, but we would call that labor trafficking. So just think, if we all decided to buy fair trade certified products, and I'm going to give you two of them that I would bet everybody who's listening has one or both in their homes: coffee and chocolate. Those are both items that you can find readily available as fair trade certified products. So I encourage you, if you like chocolate like I do and coffee like I do, that you look at what you're drinking and what you're eating. I know I can walk into any one of our drugstores and go to the candy aisle, and I can get a fair trade certified chocolate bar. And if we were all to buy fair trade certified products, think about how much we could affect labor trafficking across the world, not just here in the United States, right? So those are two places to look. Do a little research, see what you're drinking. You like Starbucks? Look and see what they're putting out there. Dunkin' Donuts? Look and see what they're putting out there. And maybe change one of those things to help support fair trade certified products and decrease labor trafficking. If you've got connections to legislators in your communities, by all means, talk it up, because almost always there's something going on in the background with regard to bills and regulations related to human trafficking. So if you got the connections, use them. If you find that organization in your community that is working really hard to eradicate human trafficking, give them some of your time. Or if you don't have the time, give them some of your money, because if they're anything like our coalition, we are completely volunteer and we are dependent upon donations and grants in order to keep running. And then I really encourage you to join a group in your area. They're out there. You just have to go looking for them. And hopefully this presentation sparked a little something in you, and will help you to think about that. Next slide, please. And these are some resources for you. I also would like to add one more that's not on here. It's called the Blue Campaign, and it is run by the United States Department of Homeland Security. And they have a ton of resources that are specific to law enforcement, first responders, healthcare providers. There's little wallet cards you can order. There's keychain cards that you can put on that help you to remember what those red flags are and remember the National Human Trafficking Hotline. We encourage you to take this phone number and put it in your phone. That way you have it no matter where you are, and encourage other people that you know. And what I would say to you is that it's important to find your why. And I say that because when I first started learning about human trafficking, it was back in early 2014. New Jersey was hosting the Super Bowl. And there, when big sporting events like that come to towns or come to states, there is typically an increase in demand when we talk about human trafficking, both labor and sex trafficking. So our government, our New Jersey government, had created a commission, and they started putting out PSAs, billboards. There were ads in newspapers, all about human trafficking and what it was and how to recognize it. And that was when I first got introduced. But then I actually met a survivor and listened to her story. And it just so happened that she was the same age as my daughter. And it really connected with me in my gut. I was there as a healthcare provider when I met her, but then I was also there as a parent. And I think that's really important to recognize in ourselves, is what is going to make you care about this. Because if you don't really have that feeling and you start talking to other people about it, you've got to be able to convey that passion. And if you think you see something, don't ignore it. We have that saying about see something, say something. It goes for this too, right? You need to speak up. And the place that you can do that is by calling the National Human Trafficking Hotline. And I apologize that I do not have a phone number for you to call if you do not live in the United States, but I'm sure it's easily found on the internet. You can call Covenant House if you are in any of the countries that are listed here, because they are an international organization. But I really think it's important to identify who the resources are in your own community too, so that you can turn to them if you have questions or you need help. And know that nationally, the Human Trafficking Hotline is a space for you to look for resources and get questions answered. Next slide, please. And we are going to play a video for you, and then we will open it up to Q&A.
You just take a seat.
All right.
Thank you so much for coming in. I'm Mary, by the way.
Hey, Mary, tonight.
Tonight, nice to
Nice
meet
to
you.
meet you.
Don't mind the giant microphone above your head.
I'll try not to.
There are 3 photos in front of you. If you could just pick one, it doesn't really matter which one it is, and show that one to us.
All right.
Could you describe her to us?
She looks youthful. I feel like this is one of those situations where if I say he's 23, then he's actually going to be 16.
Hispanic, maybe not full, but part. Similar to me, actually.
Well, I mean, she's young, so probably has a lot of things to look forward to.
I would describe him as friendly.
She looks, happy. She doesn't look shy, but confident.
Anything she puts her mind to, she could achieve.
We actually have his story, if you could read that out loud to us.
Okay, Marcus. I grew up really close to my parents. Adriana. I grew up with my brother and sister.
Amy. I remember watching the Olympics on TV when I was 5 and being totally in awe of the sprinters.
I was the middle child and easily the quietest.
I felt like no one ever saw me or cared.
Dad was too drunk to keep a job, and he never even saw me unless I was in his way.
Mom worked 2 jobs to make sure we had food for every meal, so she was never here to know when he would hit us.
One day when I went to the mall, like I like to do to be out of the house, a man came up to me and told me I was beautiful and asked me on a date.
On our first date, he drove me around in his car and said we could eat whatever I wanted.
Every time we were together, he bought me something new.
Tom really cared about me, and Tom really made me feel special.
I was in love with him.
After only going out for 3 weeks, Tom offered me a way out of my home, asked me to move in with him.
So when he asked me to have sex with him, I did.
He would put his hand over my face until I couldn't breathe.
Tom had friends over pretty regularly, and I could tell that some of his friends were into me.
So I kept my door locked and hoped that no one would bother me. After a few nights of crashing there, he said that I still owed him for letting me stay at his place.
He said he had a friend who wanted to spend an hour with me.
He told me I might have to do some stuff, but not to worry about it. It's not a big deal.
When I didn't want to, he slapped me and said no one ever cared about me like he did.
But I didn't know what else to do because I needed a place to stay.
His friends forced themselves on me and took turns while he watched.
One by one, they come down to the basement, telling me how pretty I am.
When they're on top of me, I just close my eyes and pretend I'm running.
I'm exhausted and I don't know what to do.
My name is Adriana, I'm 16 years old.
My name is Marcus, I'm 14 years old.
My name is Amy, I'm 12 years old.
I live in Grand Rapids, Michigan.
And I live in Grand Rapids, Michigan.
And I live in Grand Rapids, Michigan.
That was very different than what I thought. Especially because being a girl and imagining like if that was me, like that's, I don't even know. I can't even imagine what that would be like. She deserves to be a kid, just like what she is in this picture.
It being so close to home is something that makes me want to jump out of this chair.
I wouldn't think that Grand Rapids is a place where anything like this would ever happen.
Because you don't want it to happen to anybody, and you really don't want it to happen to people that live where you live.
Thank you for sharing her story with us. I'd like to show you something if you wouldn't mind taking her picture and following me to the gym.
Oh, wow.
I expected something certainly a lot smaller.
Bar graphs and numbers, and but these are actual people.
I don't know, in like my world, in my bubble or whatever, we don't talk about this. It's not something you think about.
You know, what we see is only on the surface.
I mean, looking at this, sex trafficking doesn't have any discrimination, that's for sure. Ages, genders, can affect anybody.
It hits you right in your heart, your gut, your stomach. It's like, wow. Now it's like I feel like I have this weight of responsibility to see how I can help.
Changes through greater awareness and making people realize that this does happen here and will continue to happen until we decide to make a stop.
Oh, that was exceedingly powerful way to end your conversation or start and open up everything to questions. The work you do as members of this coalition is so important, and we so appreciate you sharing all of your roles and stories and advice with us so we know what we can do to make a difference. I'm very moved by all of what I learned today, and I'd like to open it up to questions to the audience. And if none pop up immediately, I certainly have a few. So let me just glance over at the chat and make sure I haven't missed any.
I don't see any there yet, Rosie. But
all right, thank you, Richard. Well, please know if you're watching, you're welcome to put your questions in the chat. Ingrid, I'd like to start with you if you're okay. I think that sharing your personal story, being a mom myself, and trying to imagine and understand where you find the strength to do this work in light of your experiences is really interesting to me. And so first, thank you for sharing your lived experience. But also tell me, how do you take care of yourself doing this work and being involved in this work in light of that lived experience?
Oh, well, Rosie, thank you for the question. And it's really an honor and a privilege to be here. Somewhere early on, I recognized that as a nurse, in addition to my personal background, being raised, into adulthood, I had adopted a certain skill set that the public did not have. My background in nursing runs the gamut from behavioral health to home care to being an emergency room nurse to a critical care nurse. And somewhere I settled on advanced education and experiences in leadership. And so with that, I honed in on building trusting relationships. And that's what stuck with me. And when I found my daughter, I realized very early that here's my opportunity, that if I don't hold to my commitment to building a trusting relationship with this kid, I could lose her forever.
Mhm.
And so I brought her home. And when I realized that not only was I learning about human trafficking, the organizations around me didn't know anything about human trafficking, including the law enforcement officers who were so extremely helpful, but yet none of us were knowledgeable. You know, I brought her home and did what moms do and put her back in school and got her back on to a progression of her life. But I think dealing with homeless healthcare and many other walks of life for me, helping vulnerable people, I realized that I needed to turn inward and help my vulnerable child. And that's really where it came from.
Mm. Well, it's very, very powerful and impressive that you've been able to do that. And how is your daughter now?
My daughter's fine. She is 30. I think we all know that in life you do bring your tragedies and your triumphs forward with you. But I can say that she's triumphant. It's more triumphant than tragedy. And that she's a progressive adult with a beautiful granddaughter of mine who's 8. And my daughter's working in a school system, giving back to children who need her.
Oh, wonderful. Well, you look too young to be a grandmother.
Thank you for the compliment.
All right. Awesome. Let me peek at the chat. Anything in there, Richard?
Yes, Rosie, there's one question in the Q&A, and it's from Karina. It's of the 11,500 cases reported to the National Hotline in 2019, how many have been validated?
That's a great question. Do we have a good sense of what happens after the calls get to the hotline and we find out what the follow through?
I can speak from a personal space and then my peers can jump right on in. But as I mentioned, my daughter's not even one of those statistics, you know, and so we have developed a process by which people can report cases, get information, but then there's a whole nother level of involvement in order to bring life to fruition, to have people brought up on charges, etc. And I'll let my peers chime in.
Hi, I don't have an answer to your question, but I do want you to keep in mind, you know, yes, we provided some statistics for you, but those are only cases that were reported to the hotline. There are many, many more cases that go totally unreported. So please do keep in mind, those are just calls that are coming into the hotline. Not that we should minimize those numbers, because the fact that, you know, we've got in the United States, there's, you know, over 11,000 calls in 2019 that came into that hotline. There are so many more that never get called in. So it's really imperative that we take this knowledge that we have and help other people to understand it too, so that we can help to identify those victims and help them along the way.
Well, I think you did that super well. You orchestrated a really lovely, organized talk that taught us a ton. And I'm gonna certainly invite you back to our campus to do this again. Jean Ann, I'm sorry, did you want to say?
No, it's okay. I also want to add to both Ingrid and Diana that's just one agency that collects data. There are a number of different agencies, not only in the state of New Jersey, but also nationally, that collect data. And a lot of times those agencies don't communicate with each other. So one agency might report 11,000, another might report 9,000, but we don't know if those are the same, you know, group of individuals, or if they're separate and they're actually over 20,000. So a lot of times we just don't know the numbers per se, but we try not to rely on a specific poll, a specific, you know, set of data, but just hopefully, if you can take anything away from this, it's that a lot of times it does go underreported, and it's certainly present and it's out there, and really more importantly, we need to do something about it to help to reduce the incidence, especially when there's a major event like the Super Bowl or an NFL draft or any major, you know, convention in the area.
Yeah, that's a powerful reality. There's a question in the chat. Someone's asking, do you have any advice about resources for people who have had this experience of having been trafficked or caught up in this horrific, exploitation? Are there places where they turn that you suggest they turn?
I will speak to that just from our New Jersey perspective and from our coalition. Our coalition actually has a committee called the Providers Network Committee, and that is bringing together service providers in our state who are working together we have a resource directory on the website that we are building right now. It's a sort of skeleton right now, but really what we're looking to do is make that resource directory a place where as a survivor, I could go there, or as I have somebody sitting in front of me who needs these services, and to be able to go and find those, whether based geographically in New Jersey or by specific service. So I would encourage you to look at those kinds of organizations, because I don't think they're necessarily all gathered in one place, unfortunately, and it really depends upon your state and what's going on in that particular area, or your country for that matter. So I know that Dora had put in a question here about also about supporting, she's looking to, are we working with corporations? Interestingly is that we have through the coalition just tried to gather some support from some large insurance organizations, health insurance organizations who see this as an issue. I think it's important just you have to get out there and find out who your champions are. I don't think there's any one particular organization or corporation to go to, but yes, I think there are corporations out there who are willing to support. You just have to start making those connections.
I know there's a lot of work being done preparing healthcare providers to screen for, appreciate, and identify this, but so many of us need to learn more. And I know there's some clinical folks on this call, so please do find out what's happening at your organization where you work to support, screen for, support, identify, and help folks be extracted from this horrific experience. Richard, did you want to add something, or?
Yes, we've come to the end of our time, but I will remind everyone that there is a chat feature for this session on the Whova app and I'm going to commit to the panelists to keep an eye on that and answer questions afterwards. If anyone didn't get their questions answered, they can go to the chat feature on the Whova app and ask the questions, and you can continue the dialogue and the discussion through the Whova app. But this was excellent, very powerful from all the panelists, and I want to thank you. But back to you, Rosie.
Yeah, thank you all for the time and energy you put in putting this together. Your work on top of your day jobs, doing this important work matters. I want to bring people's attention to the power of those images. Spitting out data makes very little sense, and I think looking at the faces really can sink in. I once learned that in every hotel in Philadelphia, every day, someone has had an experience of being trafficked. And that stuck with me. Every hotel you walk by, someone there has struggled. So keep this on your radar, figure out what you can do to make a difference. Thank you so much to this amazing panel. I wish you all peace and justice the rest of the day.
Thank you for having us.
Yeah.
You're most welcome.
Thank you.